I'll be presenting this work on modeling the contribution of incarceration to HIV incidence among people who inject drugs in Tijuana. This is actually part of a broader study investigating the Mexican drug law reform, so evaluating its potential impact. Several countries are currently implementing policy reforms to their drug laws, given that criminalization has not reduced, resulted in a decreased burden of drug-related issues. So in terms of prevalence of drug use, but also illness associated to drug use and crime associated to drug use. So Mexico is one of these countries, and in 2009 it enacted the Ley de Narcomenudeo, which depenalizes the possession of a selection of drugs for personal consumption, so a small amount of a specific list of drugs. And so this was the intention to decrease incarceration rates among drug users, and it also mandates treatment at the third apprehension, with the intention to increase treatment rates among drug users. So this drug law reform was to be enforced in all states from 2012, but so far no substantial changes have been observed. And this limited enforcement could generate a misleading message regarding the effectiveness of the reform, and it's really important at this stage because several countries are looking at the experience of Mexico to inform their own drug policy reform. So it's crucial to produce scientific evidence of this potential impact. So we focused on Tijuana as a case study. This is an interesting setting to study this drug law reform because it is a major transit route where drugs are trafficked into the US, and therefore it is the main hub for injecting drug use in Mexico. So the population of people who inject drugs is large. It is estimated at about 10,000 people, and among people who inject drugs, HIV prevalence is estimated at 3.5% and incidence at 1% per year, although there are high differences within the population. Importantly, there is data that was specifically collected to study this drug law reform and its impact. So Proyecto El Cohete, which is a cohort study following 734 people who inject drugs in Tijuana biannually. It started in 2011 and it will be ongoing until 2020. Participants are tested for HIV and provide self-reports of sexual and drug-using behaviors, as well as on their experiences with policing and incarceration and access to harm reduction. So the aims of this study were first to describe incarceration patterns and associated behaviors among people who inject drugs in Tijuana, and to use mathematical modeling to, one, estimate the contribution of incarceration to the HIV epidemic among people who inject drugs since the expected start of the reform, so in 2012 to date, 2016, and also to estimate the potential future impact of stopping incarceration and providing OST, so opiate substitution therapy, and ART on incidence. So we looked at the period between 2017 to 2030. And so in terms of the methods, we carried out descriptive statistics of incarceration patterns and binary logistic regression to look at associations between incarceration and HIV-associated behaviors. And we used data at baseline, so previous to the expected start of the reform. We developed a dynamic deterministic compartmental model of HIV transmission among people who inject drugs. So we're only looking at people who inject drugs, not at the general population. And this model incorporates both injecting and sexual transmission. It is disaggregated, well, the population is disaggregated by sex, incarceration stage, and HIV stage. And we varied parameters associated with the demography, incarceration patterns, and HIV transmission, including the relative risk of infection by incarceration stage. And I'll speak a little bit more about that in the next slides. And we fitted to data on HIV prevalence and HIV incidence through time in Tijuana among this population using Lati hypercube sampling and resample the simulations that fitted the data best. And so I'll present you very briefly, some results on incarceration patterns among people who inject drugs in Tijuana. So this population has a very high exposure to incarceration. 85% of men and 59% of women have ever been incarcerated. Number of 5 times and 3 times among men and women respectively since starting injecting. And the graph here shows you the proportion incarcerated versus the duration of injection in years. So you can see that for those who have only been injecting for 2 years here, a very high proportion of men had already been incarcerated, and this remains stable through duration of injection. So this suggests that the majority of them had been incarcerated before starting injecting. It's a bit different among women. About 40% reported having been incarcerated at 2 years post starting injection, and this increases to about 70% for those who have been injecting for a very long time, so about 35 years. In terms of associations between incarceration and HIV risk behaviors, we can see that, well, we looked at recent incarceration, so incarceration in the past 6 months, and non-recent incarceration, so having been incarcerated but over 6 months ago. And we can see that for men, this was associated with any receptive needle sharing in the past 6 months. So those who have been recently incarcerated had an odds ratio of 5.3 and non-recent incarcerated 1.4. So this is quite consistent with what has been observed in the literature in other settings where those who have been recently incarcerated have much higher risk behaviors than those who have been incarcerated a longer time ago. The similar trends among women, but borderline significant. I should say that the sample size of women is much smaller. They represent about 15% of the total sample. But we see an association, a significant association for women between incarceration and needle sharing at least half the time, so odds ratios of 6.5 and 1.5. And we also see an association for women in terms of sexual risk behavior, so never using a condom with a casual partner among those not recently incarcerated. And so we used these results to inform the model, so to mechanistically represent the increased risk among those incarcerated. And so this is how incarceration is represented in the model. So people start being never incarcerated. Well, of course, some enter the injecting drug use population having been previously incarcerated. And so they go through these different stages. So never incarcerated to prison, recently incarcerated and can go back into prison, and recently incarcerated moving to previously incarcerated, so over 6 months ago. And so we simulate the baseline epidemic, so assuming no changes in incarceration patterns. And I'm only showing here one simulation, but as I said, we use several simulations that fit to the data. And then we eliminate all of the incarceration effects. So we stop incarceration rates and we we eliminate the relative risk of infection among those recently incarcerated and previously incarcerated. And we run these simulations again. We look at the period between 2012 and 2016 and look at the difference in terms of the number of new infections. And so we also looked specifically at the contribution of the period immediately post-release by eliminating this relative risk, and at the risk among those who have been previously incarcerated but over 6 months ago. And so some results. So here I'm presenting the contribution of incarceration to HIV incidence among people who inject drugs between 2012 and 2016. So I should have written that this is the interquartile range, so 25th and 75th percentile and 95% percentiles, so 2.5 and 97.5. And so you can see that the full incarceration effect has contributed to over 40% of new infections in this time period. And when we specifically look at the immediate risk post-release, it's about 20%, and the long-term risk post-release is about 25%. And so these are equivalent, but the immediate risk post-release corresponds to a much shorter period. But given that the risk is much higher during this period, the contribution in the end ends up being equivalent. In terms of the potential future impact of the ley de narcomenudeo, here we show the proportion of new infections that could be averted between 2017 and 2030 under different narcomenudeo law enforcement scenarios. So if we stopped incarcerating people who inject drugs over this period, 20% of infections could be averted. If those who would have been incarcerated received OST instead, this would increase to about 30%. And if those who would be incarcerated and instead received OST also received ART, we see that about 50% of new infections could be averted. So in conclusion, incarceration contributes substantially to HIV incidence among people who inject drugs in Tijuana. The population attributable fraction was 42% between 2012 and 2016. So this highlights the missed opportunity of the drug law reform to prevent infections. Completely eliminating incarceration among people who inject drugs would have an impact on the epidemic, but not sufficient to curb it. And I should say that this is a very optimistic scenario, a simplified scenario, because of course the ley del narcomenudeo wouldn't result in complete elimination of incarceration, just those crimes that are associated with drug possession. Referral to evidence-based drug treatment, so OST treatment for those who inject heroin, as mandated in the narcomenudeo law, would potentiate the epidemic decline among other positive outcomes, because we also expect that it would have an impact on overdose and other broader impacts in terms of crime, etc. So this is a call to scale up OST services in Tijuana. Finally, implementing this law alongside functioning HIV services for people who inject drugs receiving OST would prevent over double the number of new infections compared to simply eliminating incarceration. And I say functioning HIV services because at the moment the services available in Tijuana are not adapted to the needs of people who inject drugs, mostly because they are so far away from the center of the city. So this is highlighting the need for health services integration. In terms of limitation and future work, well, we're relying on self-reported behaviors, so this is always a limitation. The interpretation of odds ratios for the association of incarceration with risk behaviors is to some extent subjective. And of course, we rely on the model's capacity to reproduce the epidemic dynamics in this population. Future work should examine sensitivity analysis in terms of the effect of OST and ART in this population, as well as other assumptions. Focus on gender-specific analysis, because we see that the impact of incarceration is different among men and women and stronger among women. And also look at the cost-effectiveness analysis of this reform and of implementing these services. And a last slide to acknowledge collaborators and colleagues, Patti Gonzalez, Kenya Lazos, Claudia Raful, and Mario Morales, who've helped me understand the situation of people who inject drugs in Tijuana. Of course, all the participants of El Cohete study, and the funders for funding me and for funding the study. And thank you for listening.
Thank you, Anick. I will use the chair's prerogative, even though I'm a collaborator on this research, to ask a question first, if that's okay. So you've, I think presented a really nice argument for how incarceration could be contributing to the HIV epidemic and the failure of, proper implementation of this drug reform to avert those infections. So can you talk a little bit about what's being done now in Tijuana to support the proper implementation and effective implementation of this drug reform, which, if properly implemented, as you showed, could really have a substantial impact on the epidemic?
Yes, sure. That's a very good question. So there were several studies at the early stages of the narcomenudeo drug law reform that looked into why no changes were being observed. And so police officers and higher officials in the police services were interviewed, and they found out that actually there hadn't been much information in terms of the enactment of this law. So this is a federal law that has to be implemented at state level, but states already have their own laws in terms of drug control, etc. And so the Division of Global Public Health started a police education program that's actually informing the police about this law and what it entails and how it should be implemented, alongside occupational risk messages. So it's basically an intervention that looks at occupational risk among the police in terms of needle stick injuries and the risk of transmission of HIV, hepatitis C, and other bloodborne infections, but also sensitizing them to the issues of people who inject drugs in Tijuana and informing them about the law. So this has been scaled up to the entire police force of Tijuana and is expected to catalyze to some extent the enforcement of this reform. Of course, there are issues that this police education program cannot handle in terms of corruption or higher level system issues in terms of how the police functions, but it's hoped that it will at least get us some way to the implementation of this reform.
Great, thank you. Are there any other questions? Yep.
Hello. So my name is Sergio Ita. I'm a postdoctoral fellow in the Department of Medicine. And so there's a statistic that 1 in 4 of the world's prisoners are held in the United States. And so given the United States' high incarceration rates, could you speculate on the implications of your work to the number of prisoners in the United States and how that may correlate with risk of infection or transmission of HIV in the epidemic in the United States?
So let me just check that I got the question. So what would be the implication of a similar type of intervention in the US given the very high incarceration rate?
Yeah, given that the United States has such a high incarceration rate, you know.
So yes, I mean, the US has the highest incarceration rate in the world, so that's a very good question. And I mean, actually, HIV prevalence in specific prisons in the United States is much higher than what we see in Tijuana. And so there are several groups that have been investigating the impact of incarceration on the HIV epidemic in the US, and that find that it has had a very strong impact, specifically among African American communities. And so yeah, I'd be interested in doing a similar type of analysis on this population.
Question. Okay, question in the front.
Alan McCutcheon, I wondered what your views are of the cause or the mechanism of this incarceration effect. Is it transmission within the prisons? If so, is it sexual or drug use within the prison? And if not, is it some post-incarceration behaviors?
So actually what we've looked at so far has been changes in behavior post-incarceration. The mean duration of incarceration in Tijuana is 3 months, so it's relatively short. And so in this specific work, we've so far ignored it. The only thing that we change in terms of transmission in the model is that the mixing only happens within the prison as opposed to with everybody in the population. But there is some, and this is something that we can study from the El Cohete cohorts, just that we haven't looked into those data yet, but some preliminary, well, some data on behavior in prison from El Cohete 3, so a previous cohort, show that among those who injected in prison, the risk of sharing was much higher, but not all reported injecting in prison. So it's hard to know whether there is a sub-report of injecting in prison, but it is very likely that risk will be higher in prison given that they don't have access to syringes and they don't have access to other prevention methods. But there is certainly an increase in risk behaviors post-incarceration as a result of it kind of messes up with their network and with their living situation. So very often when they come out of prison, they don't have a place to live and they don't have the same support network that they had before. Plus they have been under control for several months and there's the kind of need to regain that freedom. And also the problem of overdose, that when you haven't been taking the same quantities and are suddenly exposed to the same dose that you were used to before, there's a higher likelihood of overdose.
Last question in the back.
Hi, my name is Melanie, and I'm a research associate here at UCSD working with Davy Smith. And my question is, when noting that the behavior when they return from incarceration back to the place, is there like a program or anything that they could kind of swing back into life, or is that non-existing? Or
Yeah, that would be ideal, and that's something that they have been implementing in some US prisons, where they have a parole officer that takes them along when they come out of prison and helps them get back into a job and get back into housing, and if they have HIV or any other disease, to be present for their appointments, and it has been shown to be effective. But there is nothing as such in Tijuana. So that would be a good research project.
Okay, great. I'm afraid we're out
One
of
more
time.
question?
Okay, a quick question.
Yeah, quick question. So what I'm interested in is how many of these people are migrants? And how far is the situation in Ciudad Juarez reflective of Tijuana? Because you have Mexico as the bottleneck for the entire migrant sweep from South America coming into the United States, with increasing blockage and the ability to get into the US. How many of these people are just ending up with nowhere to live, incarcerated for short periods of time, pulled into drug abuse?
Yes. So that's a very good question. Actually, a high proportion of the participants in the study are actually deportees from the US to Tijuana. So people from Mexican origin who grew up in the US and who are deported into Tijuana when they're in their 20s, 30s, and so have had no relationship whatsoever with Mexico or Tijuana, and of course have no network of support. But yes, also migrants trying to cross who haven't managed to cross, and who end up staying in Tijuana and getting into drug use. In terms of livelihood situations, a high proportion are homeless and are moved around the city very frequently, depending on elections and other political agendas. And so that's what we saw in summer last year. They used to live in the canal. Well, that's a high proportion of people who injected drugs in Tijuana used to live on the canal that separates Mexico and the US. And they were thrown out of the canal to give a better aspect of Tijuana for people crossing from the US and so that is still, it's still causing disturbance among the lives of all these people who are still trying to find a place to establish themselves.